saying again, this is one of 2 info sessions that we're having. Next one is going to be next week at lunchtime, where we are aware that everyone's schedules are different. So we wanted to make sure that everyone got the time to attend the session and ask questions. But the topics that we're going to cover in both sessions are the same. Now, for just housekeeping rules, if I can ask everyone to keep their microphone off, the same as their videos, just for bandwidth purposes. And of course, feel free to use the chat for any questions, any comments. Tanya from York University is going to help us to monitor that. So we will filter all the questions. So again, just for bandwidth purposes, if you can help us with that will be great. Now the session is being recorded, just to be able to share it with you later. So you have a copy of what was discussed today. That's really important for us. And just to be mindful of, I will go through the agenda for tonight's session. So again, these topics are also going to be covered in the next session. Today, we're going to discuss, I'm going to introduce our panel of experts, which are also part of the program that we are offering at York University. So I will ask each one of them to introduce, but before we go into that, so just for you to know, we're going to cover tonight, what is decision support? Things that you might come across that term in other situations, but if not, we are here to learn together. What is decision support? What are the opportunities there in the healthcare sector for anyone applying for that role? Also, what skills employers, workplaces are asking from people in the role to have. And then we're also going to have the opportunity to learn about the program that we have developed together with members from the industry, and that's why we have the 3 of them here tonight to help us to go through that, how we develop the program, what do we cover as part of the program, and a few more information for you in case later on you have questions about the program. You will have the chance to also ask questions about that, the same as anything that we covered tonight. That's why we're going to have a section for FAQs. And of course, at the end of tonight, we're going to share any contact in case you want to come back to us with any questions and answers. For tonight, we're really lucky to have 2 members of Helen's team who also help us to develop the course. And in first place, we have Jonathan Lam and Reza Talebi. Jonathan, do you mind just introducing quickly yourself?
Sure. So thanks for having me here. Jonathan Lam. Currently, I'm a manager of decision support and business intelligence at Northwark General Hospital. Prior to that, I was at Ontario Health, a provincial agency, and Health Quality Ontario for a number of years in the public reporting space and evaluative reporting space. So happy to be here.
Thank you, Jonathan. And Reza.
Hello, everyone, and thanks for having me. My name is Reza Talebi. I'm MD and MSc in eHealth, and I work for Ontario MD. I'm a manager for practice engagement. Our main focus is on clinical enhancement of practicing medicine, leveraging data, and quality improvement methodologies. Thanks.
Thank you so much, Jonathan and Reza. And also, I want to acknowledge that part of this team, also we have Sandeep Gill. She's also part of the decision support team who helped us to develop the program. She couldn't be here tonight, but she's going to be next week in the session. And if you have any questions or answers, like for us to go back later, you can always email us. I'm going to share the email of York University just for you to actually email any one of the instructors with your questions as well. Now, for the first slide, I will ask Jonathan just to take us through a little bit of an overview of what is decision support and what employers are asking from anyone applying for this role.
Perfect. Thank you. And I think maybe I'll actually jump off where Reza kind of said is really kind of leveraging data and evidence to help make decisions in an organization, right? And this is actually, if you look at it from, there's the provincial kind of agency level, like Ontario MD, like Ontario Health, where they're looking at data sets all across the province, like your OHIP billings, to really understand what's happening, where they should be investing money, where are issues, down to more maybe regional programs, like at the home care, different home care agencies across the province, to again at that level, like as we go down further from provincial to regional, there may be other problems or other issues to look at, and then all the way down at the service provider level. And when I say service provider, I'm talking about hospitals or primary care clinics, or home care kind of service providers, and at that level, really kind of understanding at a more detailed level of what's happening at the hospital, what are how many beds are being occupied, and during COVID was a good example, really understanding how many people have COVID. Should we be cohorting patients? Are we going to run out of ICU beds? So really, decision support plays a key role in that, and really kind of translating all the data that's out there to understanding that to be information, and then how do you act upon it? And that could span again all these different levels. In terms of kind of terms used by the industry, we have a couple listed here. On top of that, you typically you can see also kind of business partners. I have seen, or analytics consultants is another kind of a word for it, and some other areas I've also seen a little bit more generic, senior analysts or a data analyst. So those are some terms that's used by the different industries. In terms of employment level, like myself, I'm a manager that I kind of work through the decision support or analytics route. Obviously, this it has both an entry level all the way up to manager and above in terms of what it can be. In terms of, I think, opportunities for the healthcare sector, I think this will be more and more important as we kind of move along the maturity of analytics in the healthcare sector. In some ways, healthcare is a little bit behind in terms of what we do with data, right? A lot of our data now are looking at descriptive information and maybe trending information as we move into more I guess what we would call predictive modeling or prescriptive modeling, to understand, well, not just not what happened, but building a model to understand what may happen a year from now, or what would happen if we open new beds, what would happen to our length of stay of people staying. So I think it's a high demand role. Like we're seeing it across, again, all spectrums of different healthcare organizations. And finally, in terms of kind of last bullet there, skills that employers or workplaces are looking for. Obviously, I've kind of touched on analytics, data, but I think key to this role is also there's a lot of interaction with stakeholders. Our job is to understand what their problems are and how we can inform them by, again, kind of translating the data into information. So a lot of stakeholder information, really understand, I think, the context of where the data is coming from and where it's going, right? So understanding the priorities of the province will give insight into, oh, these are areas that I might want to investigate for my hospital or for my family health team. Again, so these are all like critical functions in a hospital and other organizations too. Maybe I'll pause here, Riza. You'll probably have kind of a more to add here, so I'll pass it to you.
Oh, thank you. No, you covered it really well. Thank you for that. So the only thing I would like to add is this is a very kind of unique and niche opportunity and work opportunity, basically. That's why you see so many different terms are being used, even, quality improvement specialists, things like that. The reality is, as Jonathan mentioned, part of it is because of we are lucky enough that we are in the time of information explosion, I would say. So we have access to too many, different data and information sources, and as it is a great, a fantastic opportunity to have this wealth of knowledge. At the same time, it brings a lot of challenges to the organization, and specifically healthcare. Healthcare is a very data and information intensive domain. And now that you have more data available to you, it may create more confusion. You don't know which one to pick, how to use it, and where to basically start your intervention. So that's where this course is coming from. And that's why, everybody's using different terms, because this is a kind of an interdisciplinary, multidisciplinary a role that is basically emerging and becoming more and more in demand in the domain.
Thank you both. And I just want to remind everyone, feel free to actually add any comments, questions as we move through the slides. We're happy to actually cover as many as possible tonight. So just to move through each one of the slides. And maybe one of the questions I would like to ask you that you're here is, what are kind of your professional goals? Why are you here? What do you want to learn out of this session? And I'm happy to see if you want to share with us that in the chat. It would be great to see and understand maybe what you're trying to achieve. That would be great, so we can guide you. Again, the idea of this session is also to give you that kind of side of information, so potentially to help you to maybe think, not today, but maybe in the nearest future, what you want to do with your career. Feel free, just to give you some pointers there. Maybe you might be already in healthcare, for instance, and maybe you're thinking about how can I advance my career. That could be your situation now, for instance. Or maybe you just got a new raise and they asked you to start analyzing data in healthcare, right? How can I prepare for my new role if this is something I have not done in detail? Potentially you're a new graduate coming new from you're starting your career, and maybe healthcare and decision support will be one way to go in that way. Or potentially you are transitioning. Let's say you're coming from another sector. And just to give you ideas, because we will talk about the entry requirements for the program, but maybe you're someone who studied computer science, for instance, and you have been working in another sector, in another field, and maybe you see this as an opportunity to actually keep growing, maybe this time in healthcare. So just for you to know that this could be an option as well. So that's why we're highlighting all the paths where maybe most of you are coming from. And feel free to share if there's anything that I haven't mentioned and you want us to highlight that from your end. We're happy to do so. Tanya, is there anything from the chat that you see coming there? No, right? Okay, so I'll just move through each one of the slides. And then I just want to say, and then I know Jonathan and Reza cover these, but I just at the bottom, the next bullet point is just pretty much highlighting the skills, right? That we are this will require. And I don't know if Reza and Jonathan, you want to comment more about that? I think you did already, about analysis, right? Broad thinking, performance measurements. Are we okay? Okay. So, but then what about if you're an employer? That could be another. Maybe you're an employer already, you're a manager, and you want to help your unit, you want to help others in the role. This also could be another option. Maybe you want to actually help that colleague, that staff member, that team member. And how can you do that? Maybe through helping them to develop the skills that they might need for the role, so they can help, again, a team as well. So that's what we put there as an employer too. This could be an option. Or maybe you want to discuss this with your employer as well. As again, if you are moving into this role and you want to discuss as an option, it's again, we're open to actually in the future, you have questions, feel free to reach out to us. We're happy to answer any questions, even if you are a student or an employer from that side. And again, the idea is to develop the skills further. So now let's move to the next one. And for this one, Reza, I will ask you if you could cover just kind of the learning outcomes of our program, the one that we developed together with you and the others, please.
Yeah, thank you, Odette. So the goal from this course and what you would expect to get out of it is basically are included in the bullet points. I would like to kind of use Jonathan's description of descriptive analytics and then coming to proactive and then prescriptive, basically, and then use that to kind of explain how it actually you can get out of this, leveraging those different types of analytics. The reality is, you would need to learn the context. So what kind of healthcare system Canada has compared to US, obviously, if you want to, or any other country for that matter. So if you want to kind of do any type of analytics and improvement, obviously you need to understand the context. Why some strategies and decisions that are being made in other countries may not be a good idea for Canadian healthcare system. So that's why it's important to learn those business drivers in healthcare. So that's obviously something you will get from this course. And then you will understand the importance of the data. So as I said, we are dealing with tons and tons of data, and understanding and being able to kind of differentiate between the related and relevant data with what you want to do with other type of data, and then how you can actually measure and maintain the high quality data. There's a very popular term, garbage in, garbage out. If you have, bad data, obviously you're going to get bad information, and obviously you're going to make bad decisions. So that's really key. And talking about how to basically have the data governance in any type of organization you have, from small scale community-based organization to larger scale enterprise organizations, to understand the principles of it. Then obviously reading those data, right? Finding the gaps and understanding, okay, what is it that, we are missing here? And where are the opportunities for us to make an intervention? We're talking about decision support, right? So we want to make a right decision. So you will learn how to basically identify those gaps. And then once you identify those gaps, okay, what's the process? What are the dynamics and mechanism to come up with some ideas for improvement, to come up with a plan to make an intervention that creates what we are expecting and desiring? Obviously, it's a very complicated, healthcare is a very complicated sector. So it's really key that to have that relation with other stakeholders that you're dealing with. And when I'm saying stakeholders, obviously starts with patient. So communication from patient side, from other organizations, from payers, insurance, from different departments. If we are talking about a hospital, if you're talking about a regional health center, like Ontario Health Teams, which is a new term, for example, in Ontario. So that's another aspect that you understand the importance of it, when and how to basically establish that connection and relation. And then obviously at the end is how to properly present it, right? So we just witnessed some people, they don't know how to present themselves, right? They just want to kind of use different. So, but the same thing is important here, understanding, okay, I did this data analysis, or I did this in general gap analysis. How should I present it to basically get the people fired up and get them ready to take the first step towards the improvement? So that's another key aspect of this, this course that hopefully you will get out of it.
Thank you, Reza.
Jonathan, would you like to add anything?
No, I think you covered it really well, Reza. Thank you.
Right. Thank you both. And let me just to put it in context in terms of what will be covered in case in the course that we developed. I don't know, Reza, Jonathan, you want to develop in terms of how you're summarizing and you're developing those skills in each one of the modules of the course. Do you want to take us through that?
So I will take module 1 and 2 and leave 3 and 4 to Jonathan. I just don't want to speak a lot, although I'm a talkative person, I know that. So obviously in module 1, as I said, we focus on basically laying the ground, right? Introducing, Canadian healthcare system, and understanding the challenges that we are facing with it. So we have some sort of understanding of what we might actually encounter as we get into the domain. And then we'll talk about different types of data that we're going to actually deal with, right? And what the life cycle of the data is. As I mentioned, data governance is a key factor here. And if we don't understand data life cycle, obviously we cannot, maintain and manage that. So we'll focus on that. And then there is a project management component to any type of decision support and improvement initiative. Obviously, things are like a domino. So it starts from somewhere, and it's actually like a chain goes till the end. So you have to be able to kind of drive the change. So that's really important, and that's why it's important to understand, project management skill sets. As I mentioned, once we have data, once we have insight, usually comes, okay, so what? We know that we don't have enough vaccines, or we know that we don't have enough ICUs. So what? And that's where we are going to talk about, performance metrics. We're going to talk about in module 2, talk about basically the way we kind of can make metrics or use metrics, and then obviously take those metrics and come up with some feasible improvement ideas that we can basically implement in a hope for an improvement. And then we kind of transition nicely to module 3, which Jonathan will explain about that.
Thank you. So really kind of continuing on, it's really then understanding, and there's a whole toolbox of different things you could use for user-centered design. So we'll explore a few methods on how you might go about building a dashboard in terms of understanding what the user needs are and really building something that's fit for purpose and looking at what the issues are. And then on that, we have talked about kind of performance metrics and different data, but understanding there's one particular issue is there are a lot of indicators out there to measure. It can measure a lot of different things. So how do we actually make sure that we are measuring the right things, and what are some attributes of a good measurement that we want to look at, and how do you select that, and how do you report on that? And then finally, I think in the third one is really discussion different types of both reporting and how data should be analyzed, but also I think a little bit of like looking at reporting trends. So we know through kind of the pandemic, there's been a trend on looking at more equity data, which has been actually, if anything, not looked at appropriately before. So it's serviced up. So some of that reporting on trending on what are some key things that we're looking at. So like we mentioned data quality earlier as well. I think now since the pandemic, there's a little bit more focus on timely data versus getting perfect data. And so a little bit of how those things balances as well in module 3. And maybe module 4 for the action learning project presentation. Can we go to the next slide with that?
Mm-hmm.
Thank you. So there will be a component where the students will be asked to really kind of put into practice the different skill sets or methods that you have learned throughout the course. So this is that we will be partnering up with an organization to get some real world data and also real world questions and problems, and asking those in the course to work together or individually on a project, and then to really kind of focus on that. And there will be a presentation, I believe, at the end of the program, and we'll be starting to look at this early on, and throughout kind of modules 2 and 4, we'll be developing this action learning project.
Thank you both. And I just want to mention that you might be asking yourselves, well, is it this for me because I don't have any kind of background in something? Don't worry, we'll touch base about the entry requirements. There might be a room for you to apply for these, even if you think you don't qualify. We will touch base on that. But also, I just want to summarize to what Reza and Jonathan were saying. As you can tell, our programs, even in this case, is the same case, is really practical. The idea is that you really develop and show and you feel confident with the skills that you're going to develop. That's why there's mentorship involved, there's presentation skills involved, there's definitely action learning project that to prove, and especially in a secure environment for you before you go into any kind of situation, just to show and receive feedback from, of course, the experts in the field. So just for you to know and summarize a little bit of what both, thank you, Reza and Jonathan, have been covering. And then just to move on that, just want to give you general information about, again, just a reminder, if there's any questions, there will be a section for questions and answers, but feel free to start to put anything on the chat. Here's just general information of the course that we are offering at York. through Helen. So it's 4 modules, and I think Jonathan and Reza cover that over 3 months. So to be honest, if you see anything, available, it's a great time, especially because the course is spread out. So especially for some of you are working full time, there's an opportunity for you to actually develop the skills in a short term, like 3 months, compared to other things that are great in the industry too, but maybe longer in duration. Just to say that is 3 months our course. The first session is going to be offered this spring, so it's going to start in April 10. And then that first session is going to finish around like the end, like June 21st, when the presentations will happen, just for you to know. And now maybe the question you might have is, what do I get at the end of these programs? So you will get, definitely once you go through everything and you present your project and all that, you will get a certificate of completion. And also, I don't know if some of you are familiar with the term digital credentials. So this program includes 2 digital credentials. One that is storytelling data. That's one of that what the digital credential will say. And the other one will say Decision Support Analyst Professional Certificate, which is the name of the program. And digital credentials is another way for you to show, I think is now the trend in the industry, not only in Canada, but it's growing also in the US, to show to your employers, to colleagues, that you have this skill. It's a digital, this is shown through a digital badge. It's a graphic that you can share across all your social media. Your resume is encrypted, it's secure. So any employer, any colleague from the industry that clicks on that digital credential, digital badge, they will see the skills that you develop. What do you do to acquire the skills, which is usually certificates of completion only has the name of the program. That's it, who gave you that certificate of completion and the date, right? But this one, the digital credential, goes further. It really explains what tasks were you asked to do. How do you prove that you have the skill? So it's another way to really demonstrate with words to your potential employer or your current employer that you have the skill and that York gave you, you acquired that through York University. So just for you to know, it's another way, and is a trend now in the industry. So that's another value. Again, this course is fully online. If in case you ask that question, is completely offered fully online through York's learning management system, and you will see the name of the price of the course there, just for you to know. It's also on our website. But something I want to highlight is for this course, because we are introducing this course, we are offering 7% discounts as part of this program. Give me a second, and this is just, again, this information is available on our website, and I will share the website a little bit later, just for you to know where to find it. And let me just go through that. Now, again, here's just a summary of when we will start with the program. Now, if you're asking, how do I receive the information? Okay, I register, what happens next? What are the steps? So the steps are, once you register, we process all the paperwork that is required for these and all that. If you have questions about, do I qualify, which I'm going to cover later in this one, you can always email us as well to ask us beforehand, before you submit your application. It's really important you do that so we can actually confirm that. Once everything's processed, usually the information of the program is sent 5 to 4 business days before the program start date, just so you have enough time to prepare. But I think my recommendation, I think this is for all the programs that we run, the sooner you apply, the better, just because that will help you to organize yourself on time, and especially be ready to what you're going to start. And everything is provided to you by email once your registration is processed. Now, this is an important topic, entry requirements. And Jonathan, I'm going to ask you if you don't mind taking us through all the entry requirements, and I'm happy to help you in some of that. Is that okay?
Thanks for that. I might need some help here. I think really kind of, you see here, there are 2 major different requirements. One is a bachelor degree, and there's a whole list here. And reasoning, I think, is there's a healthcare related bachelor's degree in IT, health policy, public health, social work. So it's a breadth of different degrees there, and the second bullet is a statistical course or similar accredited course covering analytics knowledge. So we're looking for use and experience of different statistical packages, such as SAS or SPSS, and there may be others in there too, like Python that may be appropriate. So like Odette said, if there are any questions on these specifically before joining, I think it's good to kind of get connected. It does note that like SQL is recommended, but not required. So it's really, in a lot of decision support work, SQL is used often, but it is something that can be kind of picked up along the way as well. Odette, maybe I'll let you kind of elaborate or anything I missed here.
Completely. And Reza, I don't know if you have anything to add, but if not, I'm happy to kind of comment. Okay, thank you so much. So yeah, you're right, Jonathan. So the bachelor's degrees that you see there listed are just some of the examples, but there could be a full list of different ones. So you can always, again, email us and ask us a question if you think you qualify. We might be asking you more information about your education and professional backgrounds just to make sure. And of course, we will share that with the experts in the industry just to make sure. The idea is that you are successful in the course. That's why we are asking for these entry requirements. Now, about what Jonathan was saying about the statistics course, it's important that you have it and it's a requirement. Now, we are not endorsing, if you don't have that and you're thinking about how can I get that training or that course. Again, we usually recommend that you go through universities. A lot of universities offer continuing education courses on statistics. We don't endorse any of them, but feel free to share with us beforehand any course that you're thinking on applying for that to get that requirement. So in that way, we can confirm before actually you invest your time there, because we are mindful of everyone's time as well. Now, the benefit about these courses, again, as Jonathan mentioned, SQL will be recommended, but it's not a requirement. I know other courses, they require that. This is not the case for this course, but if you want to think about it, that could be an option too, in case you want to pursue it, let's say. So if you're, again, another comment I just want to say, in case you're new into Canada, trying to get your credentials accredited, you can always also share with us. So to know the process that you're going through, just to make sure again that before you start any application with us, you're ready to go like any other participant. And I'm just going to move to the next slide. So how do I apply? Maybe is a question. So this is a link to our website. Again, I will follow up after this session with the link to the video recording today, and I'm going to point out the website where you can find information about the course. When you go online, you will see actually the same thing you see here. This is a print screen of our website. So you will see there's on the right side, there's two buttons, one that says individual registration. Of course, if you're applying like only for you and no one else, of course, just have to click on the individual registration button and a PDF version of the registration form will open up. And then you just have to actually go through, it's really straightforward, the application form. Again, before you do that, if you have questions, if you meet the entry requirements, please email us beforehand. Now, if you're applying as a group, when you're saying a group, let's say you're an employer and you want 2 of your staff members, groups apply for anyone 2 or above. So if you're applying like for 2 of your staff members, please, you just click on the group registration button. And again, it's really straightforward. It's a PDF registration that you have to download and just send back to us in an email. You can also fax it, but email is always a good way as well to scan it and send it back to us. And again, that's kind of pretty much the most important information. Again, this is an opportunity for you to ask any questions, and also we can also start with a few of them. But Tanya, do we have anything on the chat?
Oh, we don't have anything in the chat right now, but I just have a question.
Sure.
Just considering if someone who is a recent grad from a university degree program or a college degree program, do you feel this is the program for them? Recognizing that they may not have any experience working in the healthcare industry yet in terms of having a full-time career. They may have a little bit of experience, but would you recommend the certificate for them? Is this the learning path for them? To either Reza or Jonathan.
Go ahead, Jonathan.
Yeah, good question. I'm just thinking about it, and I'm thinking about kind of back to like a few months ago when I was hiring for people, and if I think about it that way, I think it is a helpful certificate to have. There are folks who are joining either not so much straight from university or recent grad, but from a slightly adjacent kind of field. And I think some of the hesitancy in looking at those individuals is, well, they don't have a lot of healthcare experience. Do they know the context? Do they know how things work? So I think in those cases, it would be really helpful for someone to have, like Riza can outline in modules 1 and 2, that information about healthcare and data, and then having a little bit experience in the action learning project to learn to do some of that work and some of the more foundational indicator and what's a good indicator and how to present the data. So, and I guess I'm drawing the analogy of someone who's kind of moving adjacent to like in a federal kind of government work in analytics into this. I can also see as an undergrad, not in healthcare, not in health sciences, this gives you a little bit of a boost, I think, and being considered as an applicant.
Yeah, just to follow on what Jonathan mentioned, Tanya, I would say for somebody who just graduated, because these courses, I usually see them as more applied and professional courses. So somebody who's coming out of undergrad, the benefit I see to apply for such a course is that they get that firsthand experience in a very safe environment, right? So otherwise, they have to actually look for the opportunity, get into the role, challenge with, so many, I would say, new challenges, because it's completely different in order to gain that experience. So in my opinion, it's going to be a very good head start if somebody comes out of undergrad and wants to kind of get the gist of what's going on in reality in the healthcare domain.
Thank you both. Thank you both. I'm also thinking of, recent grads from, say, York or other universities or colleges who, yes, are looking to close the gap in terms of additional skill sets they want to acquire so they can be more focused into jobs they want to apply for. Or if they want to transition from other industries as well, maybe in from engineering or computer science into healthcare.
Yeah, and I think another value and with that is the networking, right? Like getting to be there with people with experience or with other experiences, maybe from other sectors on other employment, for example, from their jobs. It's another kind of added value for new graduates, but also for the ones working in the industry currently, right? We have seen in courses, aside from this one, people from all over Canada, not only from Ontario, and they are actually sharing experience about what is happening in Alberta versus what is happening in Ontario, even from internationals. This is another, I know we discussed mainly that we will touch base about what is happening in the Canadian sector. But again, if in this session, which I don't think is the case, but in case there is someone there listening to this session from the US or other international countries, feel free to also again contact us and ask us. I think this course also was thought for people. I mean, it was mainly thought for the Canadian context. That's why we discussed the Canadian context. But we have seen people also exchanging ideas, similar situations they're facing in their own countries. So that could be another option as well. Again, it's open also for international professionals that meet the entry requirements, the same ones that we're asking from anyone, but feel free to ask us questions. Maybe the other question I could think of, if we don't have anything in the chat right now, it's what happens if I'm I'm a decision support analyst, with experience, and would I be in the same group as the others? Because that's, I think, one question that we get asked with people that have more years of experience. And then the question is, would I get mixed with people from other experience levels and all that? And I think the answer to that is yes, but I see it as a value because, again, everyone comes from a different kind of perspective. those new graduates will come with a fresh pair of eyes from different experiences, maybe also learning from you as well for those ones in the industry, and vice versa. You will be learning from each other. We have seen that happening from all the courses we have, even from clinical skills like wound care with experience on that, to people with like years of experience learning from new graduates, like coming fresh from nursing. So I think it's opportunity for any levels of experience, and also for you to learn. I think the idea here is that you feel ready, again, in a self-secure environment to learn and develop new skills. That's pretty much another. I don't know, Reza, Jonathan, Tanya, any other questions that you can think of in terms of like what you have seen there?
I think one thing that people may actually have in their mind is, as a result of this, which sector in the industry, sorry, I'm using word industry, in healthcare, I can look into after this course, is I would say, we have kind of contents from the smallest basically sector in healthcare, which can be a community-based, care provision facility, a single provider facility, till hospital and enterprise. So I would say, it applies to all of that, because, they will get the experience of kind of learning and applying the principles for both, sectors. So it kind of, covers both, end of the spectrum.
Thank you, Reza, Jonathan. Yes. So I think, again, just to be mindful of everyone's time, this is a contact information in case you have any questions. Again, we'll follow up with a copy of the recording and also the link to the website. If you have any further questions, again, you can always email us, and we will share that with Reza and Jonathan, of course, and Sandeep as well, that was not here today, just for any additional questions. And I mean, the idea is like to help you, and they don't have to be necessarily only about the course related, but about the role too, right? If you have questions about the role, that's the idea, to help you to help in anything we can. If you have questions about that. Again, thank you so much, everyone, again, for being tonight in this session. And again, we will follow up with the copy of this recording for tonight's session. Thank you again, everyone. Thank you, Reza and Jonathan. Thank you, Tanya.
Thank you. Have a good night.
Have a good night.